Welcome to Sunday night. I am starting off our podcast just a minute or two early with the anticipation that nothing goes wrong and that those tuning in a little bit early get to see me. So as per my default, please, if you've turned in, be sure to click that you can hear me and that all sounds good. The sound is coming through strong and clear. I've had some great just questions already before the show gets started. Everything from Gilbert's syndrome to somebody who's lost over 200 pounds and said, you know what, it's taken me a good over a year and I've fallen off the wagon and I need to get back on. So no, there's Angela from Tennessee. Thank you for tuning in. Sure is great to see all of you. Be sure to tell me that you can hear me sounding good. Okay, that makes me think. Thank you, Rick. Again, someday I'm going to have a studio with production managers that tell me exactly when things are going wrong before I introduce it to the whole world. But until then, I've got you guys. So thank you, thank you. Sound check. All right, thanks, Karen. All right, I am going to start out with a funny story because it does lead into what is a great show for tonight. I am going to talk about brains and ketones, and we're going to have a little contest to see if you can get the right answer on a question that I have. But I'm going to start out with a story about my two middle and youngest sons. And last week, Grandma took them to church, and our church is doing one of these series where it's called At the Movies. And I just love this series because it truly is inviting to the patients of mine that have been struggling with a brain that's not working, they're down on their luck, they're having some depression, grieving, stuck in a grieving cycle or addiction. They've just had a heaviness. And when I'm trying to say, you know what, I have some great medications, we'll have some awesome advice to get your mind working better, but you really do need a community of support. And I just am so proud of my church for having a series each fall called At the Movies, where they use movie themes, and then the Pastor Keith just actually works with some, I think it's actually Disney, that produces them in a way that is so attractive for my patients whose brains aren't working well, and they need to see that there are people in the community that care about them. So last week, the movie was that he was using to kind of grow a message from was Star Wars. And he was talking about the dark side and how sometimes life's dark side will envelop you. And he was trying to set it up for the audience. And, you know, Grandma's taken the two boys to church because my husband and I were out of town. And so they're sitting over a little further away. And the preacher starts out by saying, "What do you do in private?" And my 13-year-old says to my 16-year-old, "Poop." And at that point, the preacher goes, "The things you do in private, they can pull you down. You're keeping them a secret. The dark side is getting you. You should do the things you do in private, in public." And of course, my two teenage sons start giggling, and Grandma's kind of looking around like, "What are you laughing at? This is serious stuff." And every time the preacher tried to advance his message of, you know, if you're doing something that the dark side has got you doing and you're ashamed of it, you should be able to do the things you do in private, in public. My two little boys are sitting there in the pew laughing so hard that I had people tell me about, "Boy, your boys really thought that sermon today was funny." And it isn't until you know the mind of a 13-year-old boy that, what do you do in private? He poops. And if the preacher's about to talk about all the things that we keep in our hearts when our brains aren't working well, that is one of the funniest moments. I've been laughing about that for about 3 days. Well, it's just after the top of the hour, and I just wanted to start with a little funny story that says, hey, our brains, when we don't have them working right, do catch us and keep us down. I am an internal medicine physician for 22 years now, and am super charged about this message I'm going to share with you, but also the amount of tools I have to help somebody whose brain isn't working right. So we're going to start with just a little bit of question and answer today. This is a statement I'm going to go through, and if you're watching, you can see this this message. I'm going to scooch over this way and make this a little bit bigger. and say, if you can see on here, this is the question that I'm going to be asking you. I'm going to go through it thoroughly in a minute. And at the end of this recording, I am going to tell you the answer. There is, this is one of the little worksheets that I go through when I lead, when I teach about brains and brains of addiction and brains that are broken that need some help. And I use this slide where there are 4 true answers and 1 false answer. And I ask the audience to say, can you find the false answer? There are 4 truths and 1 false. And BDNF is one of those hormones that are one of those tools that I use to teach when I do this workshop for the Department of Defense, when we're trying to teach first responders about how brains of addiction work and what can we do to improve them. And you know, the workshop is a good 10 hours long, and I just touch on keto a little bit, but I thought I would weave in some of the things that I have found that blend both ketones and brain repair, and why that's such a passion of mine. I ended up on the ketogenic journey and teaching it because of the impressive amount of data that came out of the study of the Navy SEALs and some of the work from NASA, as well as what is the fastest way to heal a brain injury. And I go through that a little bit in my book. Let's see if I can grab this. My book that I wrote, Any Way You Can. See if I can do this. There you go. And it is the first chapter really gets into my skepticism and is this going to help my patients with brain injuries? And I use that as a launching point to teach. So I'm going to go through this slide here in just a second. We're going to set up the a different view of this and walk through this. But as we're going, please vote. So I can see some of you put your, Pam says that she thinks the false answer is D. Donna thinks it's D, and Polly thinks it's B. I really want you to post what you think the right answer is. And I am going to walk through these questions in just a minute here, and then at the end I'll tell you the answer, because I have some great weaves of teaching tools about this. And this is just a tease of what I do when I put on my workshops to teach not just first responders, but there's some undercover agents, military, teachers, preachers, youth leaders, and just coalitions throughout the Midwest that have asked me to come speak and teach them about brains of addiction. So we're going to use this one slide. So if you ever come to my workshop, you're going to see this question again, and you'll have a little bit of bonus for what the others are going to go through. So we'll come back to this scene in just a second, but in the meantime, we are going to hop over here and begin. Let's see if I can go here and push play. Here we go. All right, so again, I'm Dr. Boz, and we are going to do some teaching tonight on brains of addiction and how do we heal brains that aren't working well. I've had several people write in and give me some stories that inspired me to use this topic. So here's the question that I'd like you to answer. BDNF, brain-derived neurotrophic factor. It is a protein that's in our brains and in that water-like substance that surrounds our brain and our spinal cord, called cerebral spinal fluid. One of these statements is false. Let me read them to you. A, BDNF stimulates regrowth of damaged brain tissue. BDNF injected into the cerebral spinal fluid shows promising hope that it stimulates repair of brain cells. Low BDNF is linked to depression and anxiety, bulimia and anorexia, Alzheimer's disease, and suicide attempts. High BDNF is linked to a stable childhood, a lean body weight, and antidepressants like Prozac, Paxil, Zoloft, Lexapro. Those are just some examples. And E is 3 rapid ways to raise your BDNF. Include electric shock therapy, transcranial magnetic stimulation, and fasting. So at these workshops, I have folks divided into teams, and they kind of put their heads together and say, all right, I need you to find the false answer. 4 of these statements are true, and 1 is false. I'm going to do a little bit of teaching, and we're going to come back to the slide at the end. By then, you should have enough information that says, what is BDNF and why should you care? When I look out at folks learning about how can they improve their brain function, how can they improve the aging of their brain, this little molecule of BDNF is one of the most remarkable transitions for understanding a healing brain in the last 50 years. This was really coming to light when I was in medical school, and I tease my audience that if you were looking for funding in the 1990s and the early 2000s, and you put the little letters BDNF in your funding for government funds for a study, you would get funded as long as those 4 little letters are in there. BDNF was a protein that we had found was, when it was high in people's cerebral spinal fluid, their brains were doing some remarkable things, like if you had a stroke and you had tied off the middle cerebral artery. So this is a picture of somebody's brain. That underside is looking from the bottom up, and then the left side is looking right at their stroke, where they had kind of walled off or clotted up this middle cerebral artery in their brain, and they killed off that brain tissue. When we look at people who are going through a stroke, we were taught in medical school that once those cells are low on oxygen, the brain cells are going to die, and there's not much you can do about it once the stroke is happening. Since then, we've learned that if we take genetically identical mice and we put them all in in our research lab, and we say, all right, as soon as these mice get to be just mature enough in their adolescent years and just past that rapid brain growth, we're going to tie off their middle cerebral arteries. But before we do that, we're going to make some mice have really low BDNF and other mice have really high BDNF. And as we look at the two of those populations, those mice with high BDNF lost 1/3 less brain cells than the mice with low BDNF. And that changed the conversation in medicine. Here we had a very clear message that once you had brain cells that got low on oxygen, they were going to go through a process that was going to kill them off. Now we were noticing that if this protein was present, that they were going to be able to have more brain cells live through that low oxygen state. We went on to see that if you have a depression, or you get stuck in a grief syndrome, or you get a brain injury, whether the brain injury is from a concussion or drug addiction, if you want that brain to heal the fastest, we need to raise your BDNF. We need to push the BDNF as high as we can and make it grow as quickly as possible. We saw that there were 2 parts of the brain that can actually regrow. That's like a stem cell. Much like if I cut off part of your liver, you can grow it back. Kind of like when a lizard tail gets pulled off, it grows back. That stem cell-like effect has an area in your brain in the hippocampus that as long as your BDNF was high, we could regrow it. That was remarkable. That changed the textbooks in medicine when we discovered that. And here was this whisper of hope that if you get stuck in a pain syndrome, if you get stuck with a brain injury, if you're struggling with grief, we now know that there's this protein, this marker, that could make the brain work better. So sure enough, the researchers headed out to say, well, it's just a protein. We could make the protein in our labs. So they said, yep, here it is. In a syringe, we could make a protein. And they said, well, let's study to see if people with spinal cord injuries were able to weave back their spinal cord better if we gave them this injection. So they took a vulnerable audience, or at least one that was very committed, called our soldiers, and the next 100 spinal cord injuries of the military, they entered them into this study to say if we gave them BDNF, would it improve the way their spinal cord injury affected them? So the study goes on for a couple years. They get the soldiers entered into the study, and those 50 of them got the injection of the synthetically made BDNF, and 50 of them got a placebo, just a shot that they didn't know nothing was in it. And they followed those troops out, and lo and behold, it didn't do anything. Injecting that protein into the cerebral spinal fluid was not the answer. There was something magical about the way the brain works, that when this was high, people did better. They had less depression. Their brains didn't age as quick. If they had an injury, they got better. If they were trying to get over an addiction and the BDNF was still high, it was much easier. And that's where we come to the next slide saying, well, BDNF, I think I want some, well, actually, let's start with this. If BDNF was there, what could we do that was decreasing the BDNF? So BDNF decreases with chronic high stress. If we wanted those little mouse brains to be low in BDNF, we would have very unpredictable rules of their life. They would get electric shock when they didn't plan on it, of their little feet. So randomly they would get food and water. They would not have those, Maslow's hierarchy of needs stable. That shelter, food, and nurturing was not present. And the higher the stress in their brains and their situations, the better we could decrease that BDNF. Next, we knew that if there was depression present, that BDNF kept shrinking and getting smaller and smaller. Much like that, if there was anxiety, if we could create an anxious mouse, boy, that BDNF went down, down, down. If we interrupted their deep sleep, this is not your average sleep. This is not the kind of sleep you can measure on your Oura ring. It's actually the kind of sleep that you need some very special monitors for your brain waves to say, did they get the kind of sleep that really shuts off their brain? In fact, adults are only going to be there for 2 to 3 minutes, and then they're going to wake up, do a little cycle, go back and grab 2 or 3 more minutes, wake up again just enough to check on the body, and go back into a heavy sleep cycle. If they weren't getting this heavy sleep, their BDNF went down, down, down. Their brain injuries lasted longer. Their depression was worse. Their addiction was more of a stronghold. Again, aging, the older the mouse got, the more the BDNF went down. And last, if they were malnourished. Specifically, if they were low on iron, their brain did a terrible job of making BDNF. One of the first building blocks of helping that brain repair was iron. And if they were malnourished, specifically with low iron, you are going to be stuck in that zone of anxiety, depression, addiction, or memory problems for a very long time. Of this chart, when you look at the size of the words, it is reflective of the power of the data behind this chart. So the high stress, the malnourishment, and the poor slow wave sleep definitely are the biggest predictors of whether or not your BDNF was sinking. So, of course, the next question was, well, Doc, if that's how you make it lower, what can we do to make it higher? And unfortunately, one of the best ways you can make a BDNF shoot up was, electric shock therapy. If we ran electrical current through the brain, we were going to have you sign a form that says you might lose your memory because electrical current through the brains is not very easy for us to rein in. But by golly, it really did work. It really did raise their BDNF, shot it way up in the air. Over the next few days, that BDNF would come down. It wouldn't hit the low that it was at before, but it sure did come back down. And that's why you see in treatments for electric shock therapy, they kind of stack the treatments over a period of time, a sequence of treatments. In comparison to that, there's a treatment called transcranial magnetic stimulation. That's another stimulation of energy from the outside of the person, pushing it into the brain. And by golly, that does raise BDNF. Stable childhood. The more stable the kid's childhood, and I don't mean running all over Timbuktu, I mean bedtimes were stable, mom and dad's rules were stable, they could trust that they were going to get shelter and food and nourishment. Stable childhood, incredibly predictive of whether or not that brain was going to be resilient. Turns out lithium helps. So does SSRIs and SNRIs. That's those things I mentioned in the question called Prozac, Paxil, Zoloft, Celexa, Effexor. It actually does raise the BDNF when they take those. Aggressive exercise to the point of sweating would increase their BDNF. And last but not least, ketones circulating in your blood would increase your BDNF. Now, before I was a big proponent of the ketogenic diet, I used to have the word fasting in there. And I often had to explain what fasting was because, again, the folks watching this channel are probably very versed in the word fasting, but that took some explaining to the audiences. What do you mean fasting? I thought that previous slide said that if you're malnourished, that you're not going to make BDNF. And now you're telling me if we stop eating, we're going to have high BDNF? That doesn't make any sense. And of course, my ketone studies folks out there are going to know that malnourishment and fasting are clearly not the same thing. When you look further at these studies of what was one of the predictors of a healthy, high level of BDNF, ketones circulating in your blood was really what they were aiming for with that fasting cycle. And so just giving you a little summary here, there's one of the studies that I quoted from is that November 2008, but let me just read that out loud. BDNF is produced when you're in deep sleep. Neurogenesis, which is the making of new brain cells, is for brain cells of memory and mood are increased with BDNF. Learning is enhanced following deep sleep, which is when the BDNF is produced the most. And reduced inflammation in the brain with BDNF production happens when you have deep sleep. All right, we're going to go through one more thing before I hop back over and look at the audience. So I really hope everything is going well on the other side. I can't see your comments when I do this version. So I just want to show a couple of things that I've tried to talk to before. And that is when I had a couple, let me actually just take a second here to make sure everything is going okay. So I'm going to go back to comments, make sure everybody's doing okay. Because if it's not, then I gotta fix something. But I think it's everything. I don't see any troubles. Let's go over to comments, and yes, everybody's guessing. Good job. Keep it up. Okay, good deal. Perfect. Everybody can hear what I'm saying. All right, I'm gonna go back in and finish talking about this. You know, the reason I picked this topic for this week is I had several people writing in about, Dr. Bosworth, can you explain why my brain is working so much better? I've been fasting and I have a history of struggling with depression, struggling with addiction, struggling with memory problems, and I've been keto, and then fill in the blank. Why is it that my brain is working so much better? Can you explain that to me? So, all right, now that I'm confident everything is working well, I'm going to go finish this discussion because it really is a great teaching point. So here we go. Let me follow up with ketones do bridge the brain gap. Yes, when you look at ketones and watch to see what we've learned about brains that aren't working well, we know that your brain has fuel, and those fuels can be carbohydrates, they can be ketones, and actually it can be alcohol, but we're not going to talk about alcohol right now. We're going to talk about your brain energy, and when you've got a healthy brain that's working right, you're giving it 100% of the energy it needs to function. So when you look at that brain energy along the side, if you've got 70% of your brain function, brain energized, you are not going to, you're going to be in a nursing home. You can't function. The brain doesn't work that way. 100% of brain energy is perfect. Remember that as we go along. We're going to talk about this study that actually looked specifically at ketogenic medium chain triglycerides. For those of you watching my channel, you'll know that that's C8, C10, and the increased brain energy metabolism in those with the worst troubles coming their way, and that was Alzheimer's. Now, this does correlate to those patients out there who are having depression and having a brain that's not working right. Stay tuned. I'll loop it all back and tie it in when we get to that point. So, we need you to know that 88% is the key for the human brain. If you have 88% of the brain cells in your brain fueled, you are probably not going to have any memory problems. If you can keep the fuel part above that 88%, you will probably not have any missing brain energy. So I have this gray box on here to show you that the brain energy gap is important, and if you don't fill that brain energy, if you're in the zone below this gray box, you're going to probably have symptoms of forgetfulness. Other words are, Doc, I feel like I'm in a cloud, or I have brain fog. I think I'm being forgetful. So in this study, we are going to look at glucose, we are going to look at ketones, and then I'm going to specifically point out if there's an energy gap. We've got 5 audiences that we're looking at in this study. One of them was the young, healthy people. The next group was going to be the older folks without any memory problems. And then we have 3 groups with mild memory problems. Again, this was not severe Alzheimer's. This was just folks saying, you know, Doc, I'm feeling a little forgetful. And after we did a bunch of testing, we were pretty confident this was Alzheimer's in the early stages. We call it mild memory problems, and they are out living their life, but what I like to focus on is these are the people who you could rescue and help them if they only understood how the brain is fueled. Okay, let's get into the nitty-gritty here. So let's look first at young, healthy controls. So here was their energy. They had 100%. All of their brain cells had energy. Most of it, over 95%, came from glucose. So you'll see in that bottom, 95% at the bottom was from the sugar or the carbs or the glucose that was burned in their brain. 5% was from ketones. And we got a big perfect goose egg. There was no energy gap. Their brains were well fueled. Okay, that's your healthy people. That's who we're comparing these other folks to. Next, we have some older folks that they passed their memory problems without any struggle. But when we looked closely at what was going on inside their brain, their glucose fueled 89% of their brain, so just barely above where their brain was functioning. They had 3% of their brain was run by ketones, and it did leave that they had about 8% of their brain cells that were just hungry. They wanted energy. They said, oh boy, I would do about anything for some fuel right now. And the longer you leave that brain cell without fuel, asking for fuel, the more inflamed it gets and the less well it works. So as you look at this study, they did not have any symptoms. They passed their test perfectly. But when we looked inside to see how much of their brain was running on energy, bam, they were right on the edge, right on the edge. The next one was the folks who did not pass the test. They didn't have, they actually had mild memory problems. Again, not severe Alzheimer's, but those folks saying, I think I'm having troubles with my memory. And when you put them to the test, they did fail. They did have what we could recognize as memory problems. If you look at their energy from glucose, it was at 85%. Their ketones, again, about 3%, which is what most of the standard American diet would give you for running ketones in the brain. But that energy gap was 12%, which is right there at the 88%, right on the edge of saying, uh-oh, the years ahead are not going to be good if we don't help you. So what we did next was we added 30 grams per day of MCT to boost their ketones in circulation. They proved this by looking at their blood tests to say, well, how many ketones were in circulation? And then they were able to see how much of the brain was using ketones for energy. First, their glucose was down to 84%, so about like that of the other group. The ketones with the supplement added was 7%, and the energy gap that they had was 9%. So very similar to that second column there of the older population without document of memory problems. What you'll see there is you did boost their function from the 84% up to 91%, which allows them a little forgiveness for a bad day that their brain was not going to go hungry for fuel. You'd love to see that 9% filled because that's where the inflammation in their brain would get less, that's where their memory would be even better, and that's where their BDNF would start to go back up. Finally, they had even a higher dose of MCT. This is again your C8, C10, very important that you recognize which supplement they're using, not using C12. And they were really consistent about using this. These are standard American diet folks. They were not ketone lovers. They really used a supplement to do this study. And then they watched to see how much of their brain was running on glucose, again about 84%. When they added 45 grams per day of MCT, they got a boost of 10% for their brain function, leaving only a 6% of their brain without fuel. Again, that may seem kind of like a lot, but here you are running at 94% because you added ketones to their circulation. And I'm here to say that this is incredibly powerful when I have folks write in saying, Doctor, why is it that my brain is working better now that I'm on the ketogenic diet? And I would say it's because of the ketones and the way the ketones are able to fuel your brain. Watching to see what memory problems get better, I see patients who, when they walk through the door, I don't need a brain scan to know that their brain looks like this. They've got a brain fog. They can't focus. They're not sleeping well. I don't need a biopsy to say their BDNF is really low, and we need to boost it if we want success of getting them back to their lives and not addicted to the doctor. And that those symptoms have words. Everything from patients with tremors to concussion to migraine, Alzheimer's, ADHD, memory problems, multiple sclerosis, which is a mitochondrial issue. Again, that's exactly what we're feeding with these ketones in the brain. If they're struggling with math calculations, they're not sleeping well, my Parkinson's patients, brain injuries, and anxiety, depression, and irritable mood. These are all the different kind of brain syndromes that I talk about in my long workshops where brains are being repaired. And we link into that. How can we improve that brain? And there are some first steps that I would say, if there's somebody you love, or if you're watching this saying, boy, I think my brain does have some memory problems, I would put you to the challenge. And that is to say, boost your brain by adding ketones. Now, in that study, they added MCT, but there are other studies out there that show the key to that study was add ketones. As the ketones were circulating in their brain, it woke up. And it's not a supplement that you're going to take from now until the time you're in the grave, but it is so powerful for the broken, wilted, slumping brain with his tongue hanging out of his mouth that says, let me help you. When you look at these ketones in a can and ketones in a capsule, the salts of ketones were made in the 60s. There are several examples out there in the world of supplements. I would encourage you to support my channel by buying these, because it is what allows me the time to make these videos, do the research, and keep teaching you through YouTube for free. It's a powerful transition though. My husband is actually allergic to stevia. Fun fact, if you look at the plant stevia that it comes from, it's very similar to ragweed. He's incredibly allergic to ragweed. And although his allergies are better now that he's been on keto, every time he gets stevia in a drink or in one of the keto recipes, he'll get mouth ulcers and bloody diarrhea. So a very severe allergy to stevia. So in that keto BHB, which I nickname ketones in a can, because you take the powder, you put them there, and you shake up the ketones and just drink them. And for my dementia patients, for my patients who are so depressed they can't get their game on, I tell their loved ones, do this 3-week challenge, put the ketones in their brain, let me do the work, and watch what happens. My husband can't take that, and I'm all about supplements that I believe in, that I've really studied the chemicals of, and that my family can take. So these ketones in a capsule, the only thing that's in them is the BHB capsules. If you open up the capsules and put them on your tongue, you'll see why we add stevia to the other to the powders, and you'll see that across the brands that the ketone salts are kind of nasty tasting if you don't have a sugar substitute. But it's a wonderful way to bridge and begin people who are on a journey without understanding much about ketones, because it is kind of a complicated biochemistry. Not such a complicated diet, but if you really want to understand the mechanics, boy, I've had folks get lost in the weeds and give up because they couldn't mentally process it. I said, you should have added ketones. Your concentration would have been better. Your focus would have been better. You would have been sleeping better. And through that outcome, you would have seen an improvement in how your brain repairs. At which point, you can get rid of the ketones. I've done this slide a few times saying, if you're looking for what are the good, better, and best ways to get into ketosis, ketones in a can, those are good. MCT, C8, C10, that's a bit better. It lasts longer. But the best way to get ketones in circulation is still fasting. But that is a mentally strong person, and often that's not the person asking for help. So much like when patients come in to me to say, can I be on Prozac? I feel so depressed. I'll say, sure, the Prozac is going to help you. It's going to take a couple weeks, and it's me doing the work. But let's not have this the answer for the rest of your life. And I think of that as what these supplements are. When you look at the good ketones in a can, you put them in, they last 2 to 3 hours, and then you pee out what you don't use. So it's one of those supplements that if you put it in and I like to shake it up with some ice and some heavy whipping cream and sip on it throughout the day if I'm having a tough day. For the ketones in a capsule, I'll tell you, my husband, who weighs about 165 to 170, he'll take 5 capsules every 3 hours on the days he needs help with his ketone production. So it takes a lot of capsules to get to the amount of ketones that you find in the powder, but chemistry is chemistry, and that's what it looks like. Again, you got to take that supplement every 2 to 3 hours if you want it to stay working. When you look at MCT-C8-C10, once you put that in, your liver will convert those fats into ketones. And those ketones are going to last closer to 4 to 6 hours, maybe 5 hours. I do have a product that I'm trying to get out on the market. It's not in the show notes yet, but it will be soon. I'll update it as soon as it's to Amazon. And that is a combination of ketones in a can and the best MCT of C8, C10 that would allow them to have an improvement in their ketones for 2 to 3 hours and then give them the production of ketones for up to 5 hours. I really think that combination is going to be the best for my folks who have that wimpy, sogging brain. But let's not forget that if you really want what I do every week, it is I fast once a week. And I don't just play around. I do this to example to the people watching, not just this channel, but my clinic. I want you to say, we check our ketone numbers, we poke our fingers, and we post them together on Instagram saying, here's my Dr. Boz ratio. Fasting is about boosting your brain, about boosting that autophagy, increasing that immune system strength, and that is measurable. Getting that ketones in a can will get those numbers up. Putting those ketones through MCT will get those numbers up, and so will fasting. But you should measure them. So I am a huge fan of ForaCare. I just think their strips don't fail me as often. Here in South Dakota, the heat can wear out some of them and they don't work, and then the cold can freeze some of them and they don't work. But I've rarely had a ketone strip that didn't work from ForaCare. So I really encourage, you can find a link in the show notes to that, as well as a brief or a code. All right, so here we go. BDNF, find the false answer. So BDNF actually is a protein where when it's in your cerebral spinal fluid, it stimulates regrowth of brain tissue. That's powerful. The adage that says the brain cells you have today are all you're ever going to get, we have evidence that says BDNF says otherwise. That's just not true. It hasn't been true for 20 years almost. My whole career, that has not been true. If you inject the BDNF into the cerebral spinal fluid, it does not work. Nope, that's not going to happen. You've got to get your brain to make it. Adding ketones to your circulation actually increases the production of the BDNF, which starts the repair process. So if you have a loved one who has depression, anxiety, Alzheimer's, or God forbid, a risk of suicide, use all of the things we do to help brains work better. Work with your doctor, use the medicines that they have, but do your part by nourishing their brain with ketones to improve the production of their BDNF. I can't tell you enough how much the importance of a stable childhood, a routine bedtime, and keeping that body weight lean, very important. And then finally, number E, you can increase your BDNF with electric shock therapy. I don't recommend that firsthand. Transcranial magnetic stimulation, I'm actually a big supporter of. There's quite a bit of information out there about how that magnetic current really does improve the production. I don't let any of my patients begin that very expensive treatment until they've been in ketosis for 2 months, just to know that the neural pathway that they are making when ketones are high is going to stick around. Whew, well, that's a lot of information, and we did it in pretty good record time. I can't say that it's all of the answers to questions, but I am very much about educating people through this channel. So when I go out to do these workshops that are 10 or 15 hours long for providers, therapists, or preachers, teachers, the correct answer for that Deborah just put out is B. Yes, it is that you cannot inject the BDNF. You have to find a way for the brain to make it. So I am going to hop back over to comments and say there are several patients that have written me in the last week. It is from your writings that I said, let me focus on brains and why it is that brains work so much better when you have high ketones. And that is clearly one of the basic rules for when I'm working with a brain that has addiction, when I'm working with a brain that's depressed, anxious, ADHD, Parkinson's, Alzheimer's. There's lots of strategies that I'll use as their physician, but I do not skip that. If you can make ketones, whether that's through supplements of the salts, supplements of MCT, C8, C10, or fasting, if they're strong enough for fasting, which is usually not the case at the beginning of their journey, I highly encourage them to help me help them by increasing their ketones, keeping them in ketosis for the better part of 6 months before I even let them have not that cheat days are what I would encourage, but really powerful what happens at 6 months for brains that have been struggling. All right, well, that is a message I've been wanting to give for quite some time. Again, I can't tell you how thankful I am. I'm over 1,100 reviews for my book on Amazon. I am an independent author, and this is how I support the channel, is the sale of my book and the supplements that you can see up behind me. I am very thankful for you if you have read the book and left me a review. You have no idea how powerful that is as an author. And I've had a few people say, can I just send you a donation? I thought, oh, okay. But honestly, I would have you buy 3 books and give it to your neighbor, give it to your preacher, take it to your doctor. The power of educating people is why I started this channel. There are so many people that could benefit. If I look at the number of funerals I've been to that didn't need to end that way, it has so much to do with resurrecting the function in their brain, and they get stuck in the dark side, much like the preacher was talking about. They go in secret, they hide behind the veil of, I just can't get better. And I would really recommend just give them a 3-week challenge. Say, take those supplements every day, a scoop of that ketone powder. I do a big scoop for my patients and say, I put in a good 1/4 a cup of heavy whipping cream, some ice, some water, shake it up, sip on it all day long or until it's gone, and do that every day for 3 weeks. And I have had some of the best stories come out of that challenge. Again, this isn't forever. This is for them to resurrect their brain out of the dark side. So let's see if I can answer some questions and then just give some shout outs. So again, Angela, you are a steadfast, so encouraging to see you tune in. Let's just go through some of these questions. So again, Mary says, thank you. I've learned so much. Oops, it just scrolled. I missed it now. Let's see. I've been a bodybuilder since I was 14 and have been on the keto lifestyle for decades long. It became this money maker racket. Folks, you don't need to buy all this stuff. You know, I would challenge that. Looking at when patients come to me, there isn't this wonderful world of giving them a prescription and saying, oh, you've got to be on the prescription forever. No, it's people that are broken and they can't figure their way out. And thankfully, we live in a time when their brains can have help. Recalcitrant is the name of the handler that wrote that, and it's really great that he's had the privilege of being on keto and being healthy for however many years old he is. But I would say to those of you out there that aren't doing so well, that are stuck, I've seen you in my clinic, I've talked to you behind that exam room door, and my heart goes out to say, how can I help them the fastest? I'm going to help them figure out a better sleep schedule. I'm going to use whatever medications I can to get their brain working better. But I know now, especially after the last 3 years of what the brain data has said, that if you really want to resurrect a brain that's not doing well, start by fueling it differently. And that's why I went through the Alzheimer's data to say, here's some really broken brains. And when we fueled them differently, even them who are supposed to be genetically set to destined for memory problems, we could help them function better. And as much as the recalcitrant jingo was able to say, I don't need it and you don't need to buy this, I would say, you know what? You don't see a lot of doctors out there educating about this because we are behind the exam room doors, writing prescriptions, trying to help one patient at a time. A few of us have stepped out into this scary realm of public media and said, let me see if I can help people without ever meeting them. And I do think it's a safe, easy, effective way to help somebody on their first part of the journey, and it is supportive of the channel, so I can keep doing that. So I just want to say thank you for all the ones that did that, and I will continue to watch your comments and get back to you. I'll do a couple more because I've just seen that about 4 people talk about how much they liked the audiobook. Yes, if you, again, I've never written a book, so I got the book written, and I love audiobooks, but my mom, I remember how sick she was. She could not have read the book. She just couldn't have. It was too hard. So I would go to her and I would teach her the lessons, one lesson at a time. That's where this book came from, was not just telling her story, but the lessons I was creating for her to say, let me teach you, Mom. And when I went to say, well, I think an audiobook will reach a lot of people that just, their brain isn't healthy enough to read. It has been in years past, but right now it's not. Whether their depression or their attention or their crisis or their grief. So I said, okay, how do you record an audiobook? And I reached out to the place that does these, and they said, well, let's hear what your voice is, and we'll have 3 or 4 other folks submit what their auditions, if you would. And strangely, I won the audition for my own book. I was blinded, like they didn't know it was me, but it was like overwhelmingly, you should read your own book. I'm like, okay, all right. But it turned out awesome because you can hear how much I care about my mom as I'm reading it. So I get why they said that, but of all of the places my book is out there, the audiobook is my favorite. I actually fasted for the week that I recorded it. It took me the 3rd day before I got past the first chapter. And at the end of the book, the last few chapters, I broke my fast. And so I always challenge people to see, can you hear in my voice, my brain, actually really high ketones by this point. I think they were at 4.8, 4 to 5, 4.0, 5.0 ketones. Can you hear the difference in my voice in that audiobook? So thanks for the encouragement on that. One last question. Let's see. So lots of other, Rick Cartwright, again, you are a steadfast supporter. Thank you for tuning in. A couple folks out there with cancer. Again, that's what my mom had, and that's what we used to help her. She is, again, about to see her oncologist. She is 3 months off of chemo, and her cancer has been in her white blood cells. She's still had a normal white blood cell the last 2 months checking, so keep praying that she's doing great. And I will continue to answer your questions. I am going to sign off this week with my favorite statement. I am improving your health, 1 ketone at a time. This is Dr. Bosworth. Until next week. Thank you.